Xolair, omalizumab, is a prescription medicine for people who are 12 years of age and above and have moderate to severe persistent asthma. This means they have one or more of the following: asthma symptoms every day, one or more nights a week waking up with asthma symptoms, and a below normal reading less than 80% of peak expiratory flow, PEF, or forced expiratory volume in 1 second, FEV1, or a PEF variability of greater than 30%, which are measures of how the lungs are functioning. Xolair is indicated if the person has asthma that is triggered by year-round allergens in the air or perennial aeroallergens, which is confirmed by a doctor using a simple skin or blood test. This is known as allergic asthma. Xolair use is indicated if the person continues to have asthma symptoms even though they are taking inhaled steroids. Xolair has not been proven to work in other allergic conditions. Improvement in the number of asthma attacks and reduction in asthma symptoms will vary among patients. For those who benefit from Xolair, how quickly they respond to the medication is an individual experience. Of course, you cannot use Xolair if you are allergic to any of its ingredients.
Patients who have severe asthma attacks often describe the feeling that they're choking, that someone is sitting on their chest, or even that there's a tight belt strapped across their chest. And as a result, many of these patients feel that this may be a fatal attack that they're experiencing. So asthma is not a trivial disease. It's life-threatening and certainly is something that many of the patients fear might end their lives.
I think the worst thing about having asthma is sort of living fearfully. If you have an asthma attack, you're not prepared for it. It comes on, it can come on anywhere, and you feel like you're suffocating. So it's a pretty scary experience.
As far as my family, I was always so tired because I never slept a whole night. I was too tired to go take Josh around the block. I couldn't take him to the zoo or to the park or anything like that. I was leaving work early or not coming in at all. It was awful.
Affects where you go, affects places that you would or wouldn't go. If I'm traveling, I have to know where a hospital is because I travel a lot. So I need to know what I'm going to do in the worst case scenario.
I have to make a conscious effort to stay calm because through years of experience, I know that stress and worrying about it and getting scared is only going to make it worse.
Let's take a look at how Xolair works in the allergic inflammatory process in allergic asthma. First of all, a substance produced in the body called immunoglobulin E, or IgE, plays an important role. Xolair, the first IgE blocker, acts early in the process by attaching to receptor sites on the IgE antibody. This antibody is a key underlying component of the allergic inflammatory cascade in allergic asthma. During an allergic reaction, plasma cells produce IgE antibodies. The IgE antibodies attach to certain cells called mast cells and basophils. When the IgE antibodies come into contact with an antigen, parts of the cells start to disintegrate, which causes the cells to release substances known as mediators, which cause constriction and inflammation of the airways. This can lead to asthma attacks and symptoms. In patients with moderate to severe persistent allergic asthma, Xolair acts early in the allergic inflammatory process by helping block IgE from attaching to mast cells and basophils. This limits release of the substances that cause constriction and inflammation of the airways.
Xolair is unique in that it prevents the IgE-mediated reaction that leads to an inflammatory response in the asthma symptoms. In the cases of the severe allergic asthma patients before Xolair was available, The use of multiple medications may have in some cases helped the patient, but the problem is that we were not treating the cause of the disease. We were just adding more medications to treat the symptoms of the disease.
When I first started prescribing Xolair, in some patients in particular, I noticed a very nice improvement in asthma symptoms, which means essentially a reduction in symptoms, far fewer nocturnal or nighttime symptoms, and then less or fewer asthma attacks over the course of the therapy. And so that was very gratifying to see.
Xolair is injected subcutaneously, which means just below the skin. Your dose, which your doctor or nurse will calculate, is based on your IgE level and body weight. The size of your dose determines how often you receive Xolair and the number of injections per dose. Xolair is given every 2 or 4 weeks. Doses greater than 150 milligrams are divided into 2 or 3 injections, each given in a different place on your body, so that no single injection site gets more than 150 milligrams at a time. Do not use Xolair if you are allergic to any of its ingredients. In clinical studies, 0.5% of patients receiving Xolair developed cancer, compared with 0.2% of patients receiving placebo injections. Several different types were seen. Please discuss this information with your doctor. In clinical studies, some patients had a serious allergic reaction called anaphylaxis. This was rare, occurring in less than 0.1% of patients. Anaphylaxis quickly causes symptoms such as rash, itching, and swelling of the tongue and throat, which can make it hard to breathe and can be life-threatening. If you think you are having an anaphylactic reaction, get medical attention right away. Xolair is not a rescue medicine and should not be used to treat sudden asthma attacks. It is not a substitute for the medicines you are already taking. Never suddenly stop taking or change the dose of your inhaled steroids or any other asthma medicine you are taking unless your doctor tells you to do so. You may not see an immediate improvement in your asthma when beginning Xolair therapy. The most common side effects in patients receiving Xolair in clinical studies were injection site reactions, viral infections, upper respiratory tract infection, sinusitis, headache, and sore throat. These were about as common as patients who received placebo injections instead of Xolair.
Since I started taking Xolair, I hardly wake up at night. I feel rested in the morning. My asthma control is great. I feel like I'm doing a better job at work. I feel more involved at work because I'm there all the time. I don't feel like I'm somebody that they can't depend on. I feel like I can be depended upon at home as well. My husband doesn't have to worry, if he's got to work late, that I'm going to be able to watch our son without having an asthma